Welcome to Creating Presence. I'm Dr. Sandra Bloom, and I'm here with my co-host, Sarah Yanosy.
Hi, Sandy. Hi, everyone.
Hi, Sarah. We've spent the last 25 years working with leaders across the US and around the world to help them build trauma-informed workplaces in order to transform service delivery for all kinds of programs, nonprofit, governmental, and for-profit organizations that exist for the purpose of helping people. In this podcast, we share our insights, experiences, and knowledge in the hopes of inspiring leaders and other professionals to put these ideas into actual policy and practice.
And this is our third season of the Creating Presence podcast. And we've decided that we want to focus on some ideas around what constitutes a healthy society. And that's kind of tricky because neither one of us has ever seen one. So it's basically, an effort of imagination, but we're committed to it.
Yeah, and Sarah, considering that the national election is coming up, we all have a responsibility to be thinking about which candidates are more likely to move our society in the direction of health and away from the problems that currently exist, and get out and vote for those people.
Mm-hmm. So it probably makes some sense for us to take a look at what some of those current problems are, because if we can define them, then we have a better chance of thinking about how to start solving them.
Yeah, and I've been thinking a lot about what constitutes a healthy society, because I had to write a chapter for a book, so I had to focus on healthcare and mental health care, and oof, I had some surprises in store. For example, according to the U.S. Surgeon General's report, which is called Framework on Workplace Health and Wellbeing, and they had reviewed a number of surveys that had come up to 2022, so after the pandemic, 76% of U.S. workers reported at least one symptom of a mental health condition. And 84% of workers said that their workplace conditions had contributed to at least one mental health challenge. These are, astonishing findings. I mean, we're talking about the majority of people at work having mental health issues. And this certainly helps us account for the rate of turnover and what's called quiet quitting, that notion that people may still be at work, but not really engaged in doing the work. And after all, 81% of workers report that they're going to be looking for workplaces that support mental health for their future well-being. And that is not a dominant issue in our culture.
Yeah, they might be hard pressed to find those workplaces. As we're talking about workforce issues, it really reminds me of some, things that I see and hear on social media about the experience of parenting and caring for aging parents. And I don't have statistics off the top of my head, but I imagine that people in those categories who are contributing unpaid labor and doing that emotional and relational work will probably likely have similar kind of numbers. And they can't look for another workplace because the people they're caring for are their family members.
Absolutely. And it means that they have two full-time jobs.
Right.
And those often are women in those full-time jobs. Mental Health America is another organization that released a report on mental health in the workplace in 2022. And they did a survey of over 11,000 employees across 17 different industries in the US. And the report highlighted how much stress was affecting people and causing distraction, even in the healthiest workplaces. They noted that 80% of employees from all these various sectors agree that workplace stress was affecting to support what you're saying, not just their colleagues at work and their work, but their relationships with their family members and friends.
Yeah, I totally relate to that. I mean, as a healthcare provider myself, I definitely find that I bring my work stress home, and that I bring my home stress to work. And both of those things kind of contribute to a lot of distraction. And I have to work extra hard to kind of focus on and be present for, what's in front of me in any given moment. Um, and I think, that's the same for other people who are balancing that caring for others at home and managing their workloads. Whether that's, because they have kids or family members that they're actually caring for, or if they're managing a home or their family finances, or just contributing to their communities in ways that just aren't otherwise recognized.
Yeah, according to those findings, 71% of employees find it difficult to concentrate at work. And that is a huge difference between the previous survey they did in 2018 that came out at 46%. So between 46% and the leap to 71%, the majority of people in the workplace, and compared to 40% of workers in 2018, in 2022, 56% of surveyed employees spent time looking for a new job.
Wow.
So only 40% of these employees agreed that their company invests in developing supportive managers, and only 34% of employees stated that their company's leadership addresses openly mental health issues at all. And only 46% of those companies provided any kind of mental health training.
Yeah, I assume that's because most organizations are still kind of treating themselves as machines rather than as living systems. And we're thinking about workers as replaceable parts. And that also means that, in our organizations, we're not really thinking about managers as having the role of supporting their staff, but rather they have the primary responsibility of boosting productivity and earning money. And that machine model thinking really drives thinking about support to employees as if it's an added expense. And the reality, though, is relationships are free. Being, supportive to your staff doesn't have to cost more money. And in fact, we create environments that burn people out and create mistrust. And then replacing those staff or incurring the healthcare costs associated with burnout actually costs a lot more than providing that support on the front end.
Yeah, and it is so bad in healthcare that the CEO and the president of the American Hospital Association said this: "We are in a national crisis that demands bold, immediate action from public and private sector leaders." Bold, immediate action from public and private sector leaders. Do you see that happening?
I'll have to check to see if pigs are flying or perhaps if hell has frozen over.
Yeah, exactly. I can personally attest to the problem. Last week, on a weeknight, a good friend of mine began experiencing excruciating lower abdominal pain, and her husband was out of the state, couldn't get there, and she had to get herself to the ER. So she presented at a local suburban ER. She spent several hours laying on the floor of the emergency room so that she could elevate her feet on a chair because it lowered the pain level a little bit. Another kind patient in a wheelchair moved his chair up to block her from being walked on, but his kindness was actually a mixed blessing because he was there because of a MRSA infection in his legs. which were only inches from my friend's face.
Oh,
And
wow.
like most overcrowded emergency rooms today, the healthcare professionals were doing the very best they could, but they were, and always are, profoundly now understaffed, underfunded. I mean, it is a healthcare crisis that is being fairly ignored.
Totally. I actually had an experience. I brought my sister-in-law to the emergency department last weekend. She just had a baby and she was having problems with her blood pressure. And the hospital had experienced flooding. There was like a water main break and the whole labor and delivery unit had been washed out. So they were putting, labor and delivery patients in all these other units. And when we came into the emergency department, I have to tell you, I was really not hopeful. I was like, sort of putting on my best armor and preparation for a fight, for, like being the best advocate that I would have to be, like all my best social work skills. And I was blown away. This was like one of the first experiences I've had in an emergency department where people were responsive, they were kind, they were compassionate, and it was so interesting because when the doctors came over to check on my sister-in-law, I realized they were setting the tone. They were treating the other staff members as if they were really part of a community. They were respectful and funny, and they used humor, and they were collaborative. They asked my opinion, my sister-in-law's opinion, the techs and nurses for their opinions and what they were observing. Like it was so in the context of this like complete madhouse flooded disaster, there was this clarity about like how just the humanity and connection from the people who had authority created this amazing environment. And so it made me really hopeful about what's possible.
Right. What's possible and what teamwork really looks like.
Yeah.
Part of the, usually you don't get flooding, but
Right.
but what is more usual is the work-related injuries and illnesses that affects healthcare workers. They experienced between 2019 and 2020 a 249% increase in work-related injury and illness. And the pandemic, of course, intensified so many pre-existing risks and workload factors, staff shortages, high patient loads, supply shortages, fatigue, grief, all exacerbating those pre-existing crisis levels of burnout, of feeling emotionally exhausted and detached and experiencing a really low sense of personal accomplishment at work. Health workers experiencing increased harassment, threats, bullying, verbal abuse, or other actions from patients and coworkers, all of that creates a really hostile work environment and violence, which can increase, of course, symptoms of depression and anxiety and PTSD and suicidal thoughts.
I think about how when patients are seeking care, when they're sick or they're in pain, they're really vulnerable. And we know that those experiences of stress decrease their capacity for emotion management. And so that vulnerability can easily trigger a fight or flight reaction. And we can see patients getting hostile or combative or having other extreme reactions, even avoiding care until it becomes an emergency. And that creates more stress for the healthcare sector as well, because then, you're not seeing people until it's really urgent. And the costs are another factor. Like, I have decent health insurance, but I met my $5,000 deductible in just a couple of months between copays and prescriptions. So I think, that is added to that adds to the stress for people seeking care, and, adds to the burden of their emotional regulation capacity.
One huge cost challenge in healthcare and mental health care is the profound, pronounced shortage of nurses and physicians. The Bureau of Labor Statistics projects a need for 1.1 million new registered nurses across the US. And an Association of American Medical College reports projects a shortage of physicians between 54,000 and 139,000 physicians just by 2033. That's less than 10 years. So that is huge. And then there's the issue of the enormous increase in workplace violence, according to the government, compared to other workers. Working in healthcare and mental health care means you're 5 times more likely to experience violence on the job, ranging from verbal abuse and threats to physical assaults. So, we have a shortage. We need young people to enter the professions, and yet, why would they do that? What's going on, if they know what's going on, that's pretty scary.
Yeah, and makes sense that this is happening in all sectors of the workforce, but it is particularly significant in, the healthcare and mental health care sectors. And that workplace violence, really comes from two sources, either from patients, sometimes while they're receiving services, but sometimes from their families or others, who, come afterwards for some sort of revenge. There are cases of stalking, or violence from colleagues, supervisors, and coworkers.
Yeah, and another type is violence that's directed at a healthcare worker by somebody they're in a personal relationship with, like an intimate partner or a family member. That may occur, it may happen at home, but it may also get followed. Person might get followed into the workplace.
Yeah. The reality is that workplace violence in the healthcare industry accounted for triple the overall rate for all other industries combined, 4.3 per 10,000 full-time employees. And we're not even talking about or adding economic violence,
Right.
which may be another whole podcast.
Yeah, exactly. And it is so disturbing. And let's look at what makes it so likely in human services, according to OSHA, the Occupational Safety and Health Administration. And this is guidelines that they published pre-pandemic in 2016, that there are very clear organizational risk factors for exposure to workplace violence. And these include lack of adequate policies and staff training for recognizing and managing when somebody is escalating to hostile and assaultive behavior, no matter who it's from, patients, clients, visitors, staff, no matter who. Working when understaffed, which is pretty much everywhere, but especially during meal times and visiting hours. A high turnover, we've talked about that. Inadequate security and inadequacy of mental health personnel on site. Long waits for patients, or whether they're patients or clients, whatever we want to call them. Overcrowded, uncomfortable waiting rooms, like I described a little while ago. Unrestricted movement of people, the public, in clinics and hospitals, because these have always been places where you can just walk into. Well, that might not be such a good idea. And then a perception that violence is going to be tolerated because of the setting that you're in, and that victims really will not be able to report the incident to the police or to press charges because of the circumstances surrounding it. And that also complicates things.
It's interesting when I'm working with organizations, coaching, creating presence, this comes up a lot. There's sort of this idea of a delicate balance between what it means to commit to trauma-informed practice. So appreciating that behavior has meaning and that trauma exposure is likely to trigger dysregulation for people who are seeking services. And on the other side, kind of not allowing that behavioral communication to cross into abusive behavior towards staff. Um, you know, regardless of how we want to think about, the importance of tolerating symptom expression, we also have to recognize that we have to protect our staff. And that often becomes a challenge. I see this too, even in the outpatient clinic where I work, on a different scale, symptom expression through avoidance, right? A lot of times patients are being treated and things come up and they get overwhelmed. They will cancel or not show up for their next appointment. And then, because it's a business, they get punished for that. It's like, okay, so if you're not coming for your appointments, then you're going to be discharged and no more treatment for you.
Yeah.
And so there are
Yeah.
lots of these like complicated, where's the line and how much are we helping? How much are we protecting? That stuff comes up a lot.
A lot, all the time. And kind of you're not allowed to really get to the bottom of it, to really talk about it, because the underlying issue is our current economic system. It's about everywhere. All of our caregiving is supposed to be a business. And in the present definition of what a business is, that means that you really are only responsible to be profitable if you're in charge of that business. So, and it's huge. And it's kind of one of those undiscussables that we talk about in creating presence. And let's not forget about the American Psychological Association, because they did a report on stress in America, a nation recovering from a collective trauma. And according to their data, the long-term stress sustained since the COVID-19 pandemic is combined with the effects of global conflict, racism and racial injustice, inflation, and climate-related disasters, all contributing to the collective consciousness of Americans and just overwhelming people. Don't even know where to begin with that. And certainly when we need people to be able to use their thinking to get to the bottom of the problem and address the problems, that becomes really huge.
Yeah, that was, as you were talking about racism and injustice, I was just thinking back to that experience I had with bringing my sister-in-law to the emergency department. And as we were driving there, in my mind, I kept thinking about the statistics for death rates for Black women who are in labor and delivery units, and my sister-in-law is Black, and I kept thinking, this is a really scary situation for her medically. This is a really scary situation systemically, and we're showing up in a place where I don't know if I can trust what's kind of treatment she's going to get.
Yeah, sure. After all, one of all of these factors, one result has been a significant impact on everybody's well-being, evidenced by this major increase in chronic illnesses, especially, interestingly, among those between the ages of 35 and 44. So that increase has been from 48% reported in 2019 to 58% in 2023.
The disadvantages means that racial, geographic, and socioeconomic disparities in the population significantly contribute to burnout. among professionals, especially in healthcare. Um, 61% feel like they don't have any time and ability to effectively address their patients' social determinants of health. And 83% think that addressing those social determinants of health actually contributes to physician burnout rates. So, like, you know, some people, 87% want more time to do that, but 83% say that actually stresses me out as a doctor. I don't have the ability to be effective in that way. So we're sort of like in this cycle and, hamster wheel.
And it's a terrible cycle that can lead to disturbing levels of suicide among healthcare professionals, including physicians. More than half of physicians know of another physician who has considered, attempted, or died by suicide, and a significant increase over between 21 and 2022. And the same for residents and medical students. So, it's terrible.
Yeah. I think, when we have been working with our organizations and training in trauma informed care, the stress that they really report and experience, it's overwhelming. And we can't help them change it unless it comes from the top. But administrators and boards, they almost always want to focus their efforts on change at the bottom because they don't really get it. Like, how the economic plight of our serving systems are exacerbated by this, issue that being profitable is more important than any other consideration.
And what many young people won't realize is that it didn't used to be this way.
Yeah.
Right? This really got off the ground in the 1980s, because we've lived through it. We've watched it happen, where what we saw was that it was really the environment of the hospital and the healthcare system and our economic priorities that were changing, and that improvements tended to be really short-lived, largely because of how difficult it is to get people to take on board all this trauma-informed knowledge when they're so stressed, because our brains don't work that way. And because taking the time to learn and get institutionalize the changes in policies and procedures means it's going to cost. So
Right.
it can directly affect profitability, and that creates a terrible clash.
Thanks for listening to Creating Presence. Coming up after the break, Sandy and I are going to talk about a way that organizations can begin assessing the health of their own culture. We'll be back right after these messages.
In a world with trauma, adversity, and mental health deficits, your organization may be feeling the effects in its culture. Recognizing the need for safe, productive, and values-aligned organizations, Creating Presence can help to develop a healthy, biocratic organization. In the Creating Presence training model, your entire staff will learn to value human elements that characterize organizations, learn values that are solution-based and supportive, and implement new skills which will create capable leaders to meet the needs of staff and clients. For more information, go to www.creatingpresence.net. Creating Presence is managed by Lakeside, your resource for trauma-responsive care.
Welcome back to Creating Presence. I'm Dr. Sandra Bloom, and I'm here with my co-host, Sarah Yanosy, and we're going to continue our discussion about healthy societies by focusing on an instrument that we've developed to assess your own organizational culture, an instrument we call Optic.
We talked a lot in our last segment about these larger system issues, and that can kind of leave us feeling kind of hopeless. I think, the breadth of what we talked about with those statistics, can feel really overwhelming. But those can be resolved with systemic and political change, which we want to encourage our listeners to do. But we also want to highlight that organizations themselves can do stuff to improve their internal functioning, even in the face of these, external stressors, by focusing on their own organizational culture. And that's really what creating presence is about. That's how we try to help. And we start by using the optic assessment, Sandy, that you were just describing. And an optic stands for organizational presence of trauma-informed culture. And that instrument has 80 questions. 40 of them focus on an individual staff person's own personal experience, and 40 of them are focused on how the individual experiences their organizational culture. Each question is answered on a scale from 1 to 6, 1 being completely disagree to 6 being completely agree. And then everybody's answers are aggregated, probably aggravated too. So we sort of use that as our starting point for thinking about how we as coaches can best intervene and help them make meaningful and manageable changes.
Yes, Sarah and I developed this instrument with Lena Pasquale, who was the research coordinator on the original research project evaluating my previous work back in the 1990s, because we needed an instrument that could tell us before we started training or consulting with an organization where their strengths and vulnerabilities were from their own assessment, as well as an instrument that could then be reused later as they developed and made changes. And then some students from the Mailman School of Public Health at Columbia University created a manual to go along with it.
So when we analyze the scores, we always look for areas of strength and opportunities for growth. And since I'm the one who's doing most of the analyzing in these assessments, I want to share some of the things that are really interesting commonalities and themes, and also talk about how we use those results to target the areas for improvement. And, we do look at those strengths and try to highlight those, the areas that have higher scores, and see them as positives that we can build from or that we can leverage for improving other areas. One of the things that I always look for first is what's the balance between the scores in the me questions and the we questions, right? So what are people saying about how they practice or how they work in their environments versus what they experience with the larger organization? And when those things are sort of equal, that's a really good sign. When people are reporting like, well, I'm really great at this, but my organization really stinks. Then we know, there's a disconnect, and we need to really sort of target some leadership work. So, things that I see frequently that are strengths in most of the organizations that we work with, have been the personal alignment between moral beliefs and actions. So that really tells us that staff who are working in human services are there for the right reasons, and they really are committed to inspiring hope, and they see their roles as having value and meaning. We also see that staff in most of our organizations really value diversity, and most of the time feel encouraged to try new things and to be creative. That their organizations support learning and development, and those are really hopeful places to start from, even when things feel really messy in other parts of the culture. Like, for the most part, that's what those are the strengths that we're seeing in our service organizations.
I know assessing where people are at and where their organizations are at is a really big, often very confusing topic. So we had to try to get this organized. So we organized it around the key values of presence, the word presence, which we use as an acronym. So let's talk a little bit about those ideas. The first one is the P for partnership and power. And that portion of the assessment addresses important relationship dynamics in an organization because trauma can impact relationships bidirectionally. In an organization, power dynamics between leaders and team members really can interact with whatever trauma is going on and has happened to people. So leaders may act overly controlling or be overly passive. Team members and staff may feel really unsafe or fearful or just feel they don't have any ability to make any changes, a lack of agency. Improving partnership and power is really important to make sure that organizational members can actually fulfill their potential in their roles and have productive, rewarding relationships with their colleagues and with clients. Improving this area will improve collaboration, conflict resolution, and overall organizational culture.
So there are 10 questions in this section, and what I see as the one that stands out as, most frequently getting a lower score across the board for the agencies that we've used this with is one of those organization oriented questions, what we call the we questions. And it's that most important decisions in my department or program that will affect our clients are made by consensus decision making.
Hardly ever
Um,
see that.
Yes. So what we do in creating presence is we really focus on the group engagement skills. And the two that are most effective at kind of intervening around this area are the skill of consensus building, and the skill of six hats. Consensus building being, a way of helping people, formulate language to come at a problem where everyone gets to a place where they can live with it. And then the six hats, which we've talked about in another podcast, go listen to that one, is really about taking different perspectives in approaching a problem and having everyone contribute their ideas about what the strengths are, what the challenges are, what the feelings are, and reshaping the solution until people can get to that consensus. So
And it's really
those
fun.
two, yeah,
And
it
it's
is
really
really
fun
fun.
to do.
Yeah, so those two skills are really, are the intervention around this particular opportunity for growth.
The R is for reverence and restoration. And this really relates to that whole issue of moral alignment and purpose and meaning, the values that why people go into work that is so difficult. But trauma can make it difficult for people to orient their moral compass because they may have previously been put into challenging situations. Organizations can play an important role in helping to create really articulate and embody a just and safe environment. And then members should feel confident following their moral beliefs and that they're in alignment with the true organizational values. So through reverence and restoration, organizations can improve communication and achieve just and fair outcomes for everybody.
Yeah, that question about moral alignment is one that really pops up as a strength for overall for most of our organizations. But the one that really stands out as a challenge is about people in authority living out clear and positive values in the organization. And so, in that situation, what is most helpful is intervention with the leadership team. And we talk a lot about a focus on justice, using restorative justice, attending to the different kinds of justice, which are distributive, procedural, and interactional justice. Spoiler alert, we're going to talk a lot more about that in our upcoming podcasts. And so those are some of the ways that we kind of target those reverence and restoration areas when they show up in the optic as problematic.
The first E in presence represents emotional wisdom and empathy. And the optic, what we're looking at and trying to measure is the emotional intelligence of organizational members as well as the organization as a whole. So this aspect of presence is really important because we know that trauma and adversity can so get in the way and impact the ability of people to recognize and respond to emotions. And without addressing emotions, it's it's really challenging for organizational members to achieve their full potential. They may not feel secure sharing their feelings, setting boundaries, managing negative emotions, which are normal. Emotional wisdom and empathy is really the key to collaboration, communication, and adequate problem solving.
In this section of the 10 questions, there are actually 3 that show up repeatedly as areas for growth with most of our organizations. The first one is about openly discussing each other's triggers and knowing how to be helpful with them. The second is about having a plan for managing those emotions. And then the third is really about having a wellness plan, like really practicing self-care in a meaningful way. And so in creating presence, we really try to target some activities and discussions among staff to solidify those relationships to really help people understand what their own reactions are to certain stressors and how their teammates can be helpful, and then also really promoting individual ownership of responsibility for that emotion management and wellness, in addition to a larger collective responsibility to encourage each other in those areas.
The S in presence is for safety and social responsibility. And it really is focused on the wide definition of safety that we use, which is the achievement of physical, psychological, social, moral, and cultural safety. And it's how members feel for themselves and others in terms of their sense of safety. Because most people have to be able to learn how to keep environments safe, how to be safe in that broad sense. And it is particularly important for those who have experienced trauma because we know that under stress, the body focuses on fight, flight, freeze, and everything else is pretty much put on hold. So the only way that people can feel secure is if they are in safe environments. So we have to ensure that all organizational members are able to pursue their goals and to grow and to work with their team towards common goals of being really safe while still being able to take the risks necessary for healing and recovery.
It's so interesting that in the results of the optic in our organizations, there are 2 questions that show up pretty consistently, and both of them are really about relational or social safety. The first one is, um, if I feel like I let someone down, I'm confident that they'll come to me directly instead of going behind my back. And the second is employees feel a sense of safety with organizational leaders. So we can see there that like the issues of fear and power and authority, that's really what's coming out in these results. And so as an intervention, we focus our coaching on conflict styles, communication styles, and targeted work with leaders on their leadership styles, and really talking about kind of matching and knowing each other as a foundation for creating that safety in relationships. And it takes a lot of work. But what's amazing about creating presence is That's what it's about. We're dedicating time to do that work, and that's what shifts the culture.
The second E, there's 3 E's in presence, stands for embodiment and enactment. That's about how well members of the organization recognize how they and other people hold on to traumatic experiences through not so much what we're conscious of, but through our behaviors, and how equipped the organization is to respond in positive ways to these behaviors. It's important to understand that people who have experienced trauma may relive and recreate their traumatic experiences in the present, including within their workplace environment, without even realizing it. And these reenactments may occur through focusing on other people's needs, seeking acceptance, avoidance, all kinds of ways. So improving the embodiment and enactment scores promotes insight and empowered behavior.
Yeah, of the 8 sections, 10 questions for each letter in the acronym, this is the one that almost always has the lowest scores overall, because we don't teach people about reenactment. So their knowledge base
Right.
is lacking, understandably, and their ability to respond to larger collective organizational reenactments is limited. And this one question, and I love the wording, it's when there's an elephant in the room, we usually have a meeting to talk about it and figure out how to solve the problem. Um, that one is almost always, a flashing indicator. No, we do not do this. And so, of course not, because we talked about in our first segment, like time is scarce, relationships are stressed. So we really focus on in these response to these questions, learning about reenactment, learning about how to disrupt reenactment, using language specifically to do that, and processes specifically to do that. And also about collective disturbance, like really focusing on understanding, collective trauma.
Really important. And you are absolutely right. That's the one that gets the most neglected and is the hardest and takes time. And time is money in our system, and that's part of why it doesn't get addressed. So the N is for nature and nurture, and this is about how people perceive their own and their organization's ability to respond to their previous experiences of usually of adversity because of the rate of adversity in our culture, and how to foster a nourishing and safe environment. Organizations that do well in this category kind of meet their members, whoever they are, where they are, and accommodate previous experiences, not excuse it, but understand it, while promoting new experiences that can continue to shape people's experience positively. The survey statements assess an individual's level of confidence in their knowledge on how prior trauma shapes people and their relationships, and then assesses an individual's feelings and responsiveness to trauma and how that impacts their relationships with their colleagues. The organizational questions assess how well an organizational culture has policies and procedures that really helps to foster and maintain a healthy trauma-informed system.
It's really interesting that the scores in this category, almost always are really about knowledge, like the lack of knowledge around the ACEs study. And so a lot of what we're focusing on in this, part of the intervention is just helping people be able to articulate the connection between early childhood adversity and later, health outcomes, and really recognizing what that means for the people that they're serving. And so, in our coaching sessions, we're not just talking about like, okay, how do you, know this and learn it, but also how do you apply it? How do you engage with your clients around their early childhood experiences of adversity?
And all of this that we've been talking about speaks to the C in presence, which is about culture and complexity. That indicates what we're looking for is the capacity of individuals in the organization and the wider organization to really create a healthy and supportive work environment that can respond to the complex demands of what's going on in our culture and what has already happened to people as a result of adversity and trauma. In an organization, we understand that everybody is interconnected to everybody else, and it can be really challenging to change an already existing ingrained culture that might have been around for 2 years or might have been around for 100 years. So you got to find that out. We have to assess an individual's perception of their capacity to engage in very complex conversations and the surrounding feelings within the context of their organization. And then we've got to assess the efficacy of the organization's culture in terms of whether it's open to change and to adaptation, to really change its practices as well as protect its members.
In this section of the optic, um, one of the early questions is about, when our teams meet, we begin with an emotions check-in, and set our goals for the meeting. People don't do that. So we have a very practical skill, which is the presence meeting, that we focus on and sort of addressing that. But the other one is that employees can easily communicate the story of the organization's change, growth, and development. And I think when that shows up as a lacking area, it really says people don't know the trauma history of the organization and they are in it and they are living out the recreation of that trauma history every day. And so, we do some work about memorializing and integrating the organizational trauma history as the intervention around this question.
Yeah, that's so important because often something really bad has happened. Lawyers come in and say you're not allowed to talk about it. It gets resolved over time, but nobody ever talks about it again. So that young people come into a new organization, don't have a clue about anything, and yet it is profoundly affecting function. So the last E is for emergence and evolution. And that measures how individuals and the organization understand all of those changes over time. And individuals with trauma can grow beyond their past experiences, and so can organizations, and so can everybody in an organization creatively grow, change, evolve. And we're hoping that really new concepts emerge out of this whole experience.
I think about, the areas of opportunity overall for coaching. And what really stands out to me is, I talked a lot about the knowledge and the skills, but also some of the policies and practices. And we do a lot of work around conflict management, disrupting reenactment, but also about supervision, like really having a structure for managing how we encourage people in the work and how we evaluate people in the work. So it's that knowledge, skills, policy, and practice overlap that we are, really focusing on. And over the course of the next few months, you and I are going to take a look at what is happening in our organizations, recognizing that there's a wide range of societal, cultural, structural, and organizational factors that contribute to organizational culture problems and burnout among workers, including and especially healthcare and mental health care workers. We'll talk about why these factors exist, how they often amplify and reinforce each other, and how we need to use multi-pronged solutions to respond to these problems, and how creating presence helps us do that. Thanks so much for listening to Creating Presence. Join us next week. Sandy and I will talk about what it means to create a healthy society. You can reach us at creatingpresence.net or voiceamerica.com. See you next week.